Good afternoon, everyone. Welcome to today's update on COVID-19 in Alberta. With us, as always, is Dr. Dina Hinshaw, the Chief Medical Officer of Health for Alberta. Dr. Hinshaw will provide a brief update, and then we will open the floor to questions.
Thank you, Tom. Good afternoon. In total, there are now 4,866 people who have recovered from the virus in Alberta, leaving 1,361 active cases. Currently, 73 people are hospitalized with COVID-19, with 12 of those admitted to ICUs. Based on 3,173 new test results over the last 24 hours, we have confirmed 45 new cases. I'm sad to report that the total number of COVID deaths has increased by 1 to 118 deaths in Alberta. I wish to extend my condolences to the friends and families of these individuals, as well as to all Albertans who have lost a loved one recently. As of today, there are 105 active cases in outbreaks at continuing care facilities across the province. 559 residents of continuing care facilities have recovered. At the Cargill facility, there are now 25 active cases in workers and 920 workers who have recovered. There are also 44 active cases among workers at the JBS plant in Brooks. At this facility, 582 have now recovered. And at Harmony Beef, there are 12 active cases in workers and 28 individuals who have recovered. I know when I provide these numbers, it can sometimes be difficult to understand what's happening behind the scenes to combat the outbreaks and bring these numbers down. I want to recognize the Alberta Health and Alberta Health Services teams who are working tirelessly on our response to these outbreaks and our COVID response in general. Their efforts have been vital to our ability to prevent spread of this virus and address immediate concerns in outbreak situations. Their work and the work of many partners such as primary care and newcomer organizations, among many others, is wide-ranging and incredibly important. These teams are providing essential, on-the-ground public health guidance to operators and employers. They've been testing anyone who may have been exposed and have been working to ensure these groups feel supported and have the information they need to prevent spread and stay safe. Public health teams are also working with our data to ensure that we understand how cases are connected, where exposures of concern may be happening, and therefore what measures may be most effective in control of spread. The team at Alberta Health is also working to provide analysis of the situation in Alberta and how we can learn from other jurisdictions as we plan our way forward. They are responding to questions from the public and businesses about how to interpret public health guidance and are working to incorporate this information into further guidance to inform the public. I also want to recognize the many healthcare practitioners who are fighting the virus in other settings, in acute care, continuing care, or congregate living facilities, or in family clinics where patients are still receiving regular health care. Thank you for your dedication, compassion, and efforts throughout these unprecedented times. I want to remind everyone that family doctors are still providing care to patients and want to encourage anyone who needs care to call their doctor's office to arrange the best way to receive that care. Most family doctors can do virtual visits by phone or other means and can determine how to best get patients the care they need. Today, I would like to provide a bit more information on the workplace guidance documents that were released yesterday. As I have mentioned before, we have provided a very detailed guidance document that applies to all workplaces. This guidance document was in place to provide expectations to all those places of work that have remained open throughout the past few months, and it has recently been updated with more information. These guidelines are applicable to all settings, whether it is a shopping mall, retail business, or a specific sector. Businesses can work through these guidelines and make decisions about how to apply the guidance to their specific setting. This will look different for each environment. In addition, we continue to draft more specific guidelines for certain sectors to reflect unique needs, such as those we have posted for child care facilities and bars and restaurants. An important thing for all businesses to consider is what mechanisms they can put in place so patrons understand what is required of them. Business operators know their business better than we can. And it's a two-way street. Customers and business operators are both responsible for being safe and using common sense. In many settings, it may be appropriate to post signs reminding patrons to not enter if they are feeling ill, and to remind them to maintain 2 meters between themselves and other customers. Business operators will also need to have a mechanism for checking to make sure their employees are well, and to ensure that their employees go home if they are ill and to seek testing if necessary. If businesses have specific questions as they prepare for opening, they can email bizconnect, bizconnect@gov.ab.ca for help with specifics that may not be answered through the website. There is also a commonly asked questions section that will be updated daily. As we move into our relaunch, I encourage all Albertans to help reinforce these new social norms with each other. Once we reopen, we want to stay open, and we want businesses to be successful and Albertans to stay safe. And I also want to encourage all of us to be kind to each other as we remind each other of these new social norms. This is a new world we are all navigating, and being kind and compassionate will help us all. Finally, I'd like to touch on the concept of cohorts, as I've seen this question pop up again on social media. A while ago, I mentioned how 2 families could form a cohort to help split child-minding activities and provide an opportunity for parents and children to socialize. I know that people want to see family and friends, and to see them in a way that doesn't keep them a hockey stick apart. As we move into relaunch, it's important to remember that limiting the number of people you come in close contact with is the best way to limit the possibility of spread. Expanding your cohort to a very small group of people can work, but you need to follow all guidance and ensure that everyone is committed to only being a cohort with each other. It is important that people still limit social contact with others outside of this cohort. Social gatherings where people share food and drinks are a risk. Kids' sleepovers with friends are a risk. These activities should only happen with a small cohort group. I know all of us are looking towards these next few weeks with optimism and concern about what's in store as we begin to open up. We have arrived where we are today because of Albertans' commitment and discipline, making sure we're following public health guidance and protecting each other. I ask that you stay the course and continue to practice physical distancing, hand washing, and other measures in order to make our relaunch successful. Thank you, and I'd be happy to take questions.
All right, we'll go to the phone now. In addition to Dr. Hinshaw, we also have Dr. Mark Jaffe, Vice President and Medical Director with AHS available. Operator, could you put through the first question, please?
First question is Jason Herring with the Calgary Herald. Go ahead, Jason.
Hi, Dr. Hinshaw. We're less than 48 hours away now from this potential relaunch Phase 1 date of May 14th, and we still don't know whether the Phase 1 will move forward or not. Is this really something that the province is expecting businesses and municipalities to react to with only a day's notice?
So I absolutely understand that it's challenging to be making preparations and decisions when a final decision has yet to be made. The Emergency Management Cabinet Committee will be meeting today and will be making a final decision about proceeding forward. And while I recognize there is that challenge that people ideally would have a lot of lead time, it's also important to make sure that we have the most up-to-date information about our data, about how our trends are going, so that we can take that into account as we make those decisions. So I would ask that businesses and patrons of businesses be patient, because we do need to make sure that we have that most up-to-date information to discuss as the consideration is made of the relaunch date. And as soon as that decision is made, that announcement will happen tomorrow to make sure that people are aware of what the outcome was of that decision.
Operator, could you put through the next question, please?
Kevin Nimick with CTV. Go ahead, Kevin.
Hi, Dr. Hinshaw. Many Alberta shopping malls are preparing to open on May 14th. As you just said, it may they may not be sure that they can open, but they're preparing for it, alongside normal retail businesses. Do you have concerns around the safety of malls compared to other smaller shops? And if one positive case is identified from a patron or a staff member, would the whole mall need to close for a period of time?
So shopping malls, with respect to the ability to keep distant from each other, typically the corridors in shopping malls are fairly large, and there's space for people to be able to distance from each other. So as we know, this is a virus that spreads by close contact with contaminated surfaces and with respiratory droplets. So if someone is within 2 meters of someone else who's infected, that can possibly pass the disease on to someone else. So having two people passing each other in the corridor of a shopping mall, particularly if they're 2 meters apart, would not be considered to be a risk. And so we would expect that mall operators would be following the same guidance as any other place of business. They would be incorporating increased cleaning, increased disinfection, particularly for washroom facilities in those buildings, that there would be increased cleaning and disinfection, and that they would be looking at our worksite guidance and making sure that the measures that are in place that are recommended in those guidelines are being implemented in those malls. If there was a single case in a retail store, it wouldn't be necessary for the entire mall to close. It would really depend, again, on where that individual had been while they were considered to be infectious, as to what measures would need to be taken to prevent spread to others. But again, a shopping mall would need to follow all the same recommendations as any other business and would need to apply that guidance into their setting.
Operator, could you please put through the next question?
Next is Jeff Slack with 660 News. Go ahead, Jeff.
Hi there. Germany reported an acceleration of infections after easing lockdown restrictions, and South Korea scrambled to contain the spread of the virus that was connected to a nightclub over the weekend. Are these concerning to hear since we are about to reopen, and do you expect to see a sudden rise in cases once we do?
So we've been looking very closely at other countries and states in the U.S. that have started their reopening process to see what kinds of lessons we can learn. And there's been some different experiences. So some countries, such as Austria, have moved into reopening with very little spread of the virus. Other countries, such as Germany, have seen more of an acceleration of spread. Some states in the U.S. have seen very sudden, sharp rises as they've reopened businesses. Other states have not seen that same pattern. And so we will absolutely be watching very, very closely to see what happens. We'll be presenting the recommendation and the data for our current state to the Emergency Management Cabinet Committee tonight for a decision about the opening of Stage 1 and the timing of that. And then at the point that the reopening starts, we'll be watching very, very closely to monitor any potential uptick in cases and making sure that we're able to provide that information back to the public and consider whether any further measures are needed to control spread. But again, there are quite different experiences in different countries and states, and so we are wanting to make sure that we are cautious, that we're recommending and reminding Albertans that they still have to follow all of the guidance that we've been talking about for months now. And certain things, such as the experience in South Korea, we're learning from, and nightclubs are not something that we're contemplating opening in any early phase because we consider those to be a high-risk environment.
Operator, can you please put through the next question, please?
Next is Michael King with Global TV. Go ahead, Michael.
Hi there, Dr. Hinshaw. Looking for any information on the Cascades cardboard packaging facility in Calgary and whether or not there will be company-wide testing at that center.
So the information I have about the Cascade Recovery Centre is that they have had 14 confirmed cases so far, and Alberta Health Services is working with them to make testing available to all employees at that site. So anyone who works there, whether or not they have symptoms, would be eligible for testing as a part of the comprehensive outbreak management work that's going on at that site.
Operator, could you put through the next question, please?
Next is Julia Wong with Global News. Go ahead, Julia.
Hi, Dr. Hinshaw. You were talking about data and trends and making sure that we have the most up-to-date information. What would those trends and data have to show for stage 1 to not go ahead on Thursday?
So the triggers that we have put into the relaunch strategy, there's 2 triggers that must be met in order for stages to go ahead. And those 2 triggers are our hospitalization rate must be stable or must not have increased more than 5% in the previous week. And our ICU occupancy has to be less than 50% of what our available beds are, and that's necessary but not sufficient. We also have to see that our cases are relatively stable, that we're not seeing a sharp increase in cases, and that we, in terms of outbreaks, that we're not seeing significant large outbreaks that are causing us concern that there's significant virus spread in one or more communities.
Operator, could you put through another question?
Next is Kenny Trenton with Kix FM. Go ahead, Kenny.
Hi, good afternoon, Dr. Hinshaw. My question is that with quite a bit of recoveries, most of them approaching the 5,000 mark now, from any of those recoveries, is there any information that maybe you would have learned from some of the recoveries that could say, hey, maybe this works as a treatment or this doesn't work as a treatment?
So the studies that we have ongoing right now, there's one study on hydroxychloroquine, which is a malaria medication that's been reported to possibly be helpful with the virus. We've seen some reports out of the US and other places where they studied that medication that unfortunately it's not as helpful as perhaps people had hoped it was. The study that's being done in Alberta is using that medication for people who are diagnosed early. So in many places, the information that they were looking at was how that medication helped people who were more severely ill, who were in hospital, whereas in Alberta, we're looking to see if that medication helps people if they start taking it when they're first diagnosed. And so that hasn't necessarily been going on for long enough to give us results yet. So we'll be watching to see if that yields results. But there's not really any other specific treatment that at the moment we have results for. There are some other studies that are being planned and will be initiated in Alberta. But at the moment, again, it's relatively early to know what specific treatments might be useful.
Operator, could you put through the next question, please?
Next is Tom Vernon with Global News. Go ahead, Tom.
Hi, Dr. Hinshaw. Thanks for taking my question. Question around restaurants, and if we go back this week, who should be going? Are we talking about going in our close family and cohorts, or are friends allowed to go have a drink? I imagine social distancing around tables will be a little tricky to maintain. If we can get a little bit more guidance on that.
For sure. And so when we put out the bar and restaurant guideline document, that was really aimed at business owners with respect to what requirements they needed to put in place to operate the business. But our general advice to the public is that you should only be going out to restaurants or bars and sitting at tables where you're closer than 2 meters apart with your household or with your cohort. Because we continue to advise that when you're closer than 2 meters to someone, especially sharing food and drink, that puts you at risk of transmitting the virus. So the recommendation would be that if you can go and sit 2 meters apart from someone and maintain that 2 meter distance the entire time you're there, then that would be the only condition that we would recommend, that you're sitting with someone outside your household or your cohort.
All right, we've got time for 3 more questions. Operator, could you put the next one through, please?
Next is Heather Yoricks with Global News. Go ahead, Heather.
Dr. Hinshaw, I'm just wondering about the situation in Brooks, the community as a whole. How many active cases are there, and what's happening with testing? Is testing open to asymptomatic individuals like it is in Calgary, in Brooks as well?
So as of today, there are approximately 200 active cases in the community of Brooks, so that's that community-wide. And so the majority of cases from that community have recovered. There is a second testing site that's been opened in Brooks to open to asymptomatic people who are interested in being tested. That began yesterday. I understand it's running for 3 days, so yesterday, today, and tomorrow. And that will help to get a sense of the spread of disease and presence of disease in those in that community. The first time this clinic was run, there was a 3-day testing clinic that was run in Brooks a few weeks ago. And many of the positive cases that came through actually had symptoms that were on our expanded symptom list. So while they may not have had a cough, for example, they might have had diarrhea or had some kind of a stomach upset. And so it's interesting that that expanded list that we put out, that's actually some of those symptoms that were being seen by some of the people who did test positive in the first asymptomatic, so-called asymptomatic clinic in Brooks. So I would just take this opportunity to remind all Albertans that if anyone has any symptom on that expanded list, which includes things such as muscle aches, it includes things such as a new unusual headache for a person, conjunctivitis, so what's not commonly called pink eye, loss of smell, loss of taste. Those are all symptoms that anyone across the province, if you have any of those symptoms, then please go online to the AHS online tool and arrange to get tested, because those can be, in some cases, symptoms of COVID-19, as well as the cough, fever, shortness of breath, runny nose, and sore throat that are the most common.
Operator, could you put through the next question, please?
Next is Licia Corvella with Post Media. Go ahead, Licia.
Good afternoon, Dr. Henshaw. There was a ministerial order made by the Minister of Health on May 4th that gives you, as the Chief Medical Officer of Health, the power to divulge the health records of Albertans to police should they ask. First of all, I was just wondering what your views are of that law and whether or not you've been asked for any of this information by the police.
Sure. So that ministerial order follows a piece of legislation that we have in the province that is an order that... So the piece of legislation allows for disclosure of a bloodborne pathogen for a first responder who is exposed to blood or body fluids of someone. And it allows for, if that person doesn't give consent, but the first responder is exposed, then the person who is exposed can apply to find out if that source person did have HIV, hepatitis C, or hepatitis B. And that piece of legislation did go through many years ago and is a part of the legislative framework in Alberta. So the COVID-19 addition to that was done through ministerial order does allow in very specific circumstances. So if a police officer in the course of their duties has someone assault them, for example, by spitting on them, and the person claims to be COVID positive, then in those circumstances, again, in those very specific circumstances, that police officer is able to request the records of that person to find out if indeed that person does have a diagnosis of COVID-19. So that is the only circumstance in which that disclosure of information is permitted. And I would have to check and find out. I know we did have some requests that came in prior to the ministerial order, which was the prompt for getting that ministerial order in place to allow us to do that. I'm not sure if we've had any requests since that time, so we'll have to look into that and get back to you.
Operator, could you put through our final question, please?
Final question is Jennifer Lee with CBC News. Go ahead, Jennifer.
Hi, Dr. Hinshaw. You've spoken a few times just about the regional differences in terms of transmission rates and outbreaks, and I'm wondering, given that, what recommendations you're going to make in terms of the relaunch? Like, are you comfortable moving forward with reopening businesses in Calgary, for example, where we still have those high transmission rates and we're still seeing a growing list of outbreaks?
So that will be part of the discussion tonight at the Cabinet Committee, is talking through the risks and benefits of having a regional approach. And so there's no one perfect answer to relaunch. Certainly if we take a regional approach, there's the risk that we could further spread transmission if people from an area that's closed travel outside that area to get services elsewhere. But of course, there's also the risk of spread with opening things up. So that's the kind of discussion that needs to happen to make a final decision. And again, there really is no one perfect way to do the relaunch. What we need to do is balance the needs of all Albertans, the safety of all Albertans being paramount, and looking at, again, these options and how we can find the best one that helps us all go forward in a safe way.
Thank you, everyone. We will provide another update tomorrow afternoon.